Adults are now fully vaccinated. We're now averaging 3.3 million shots in arms each day. Meantime, the CDC is also reporting 5,800 cases of, quote, breakthrough infections. That means positive COVID cases in people already fully vaccinated. The agency says the majority of these infections were not hospitalized, and 29% of the folks were asymptomatic. The CEO of Pfizer now says people will likely need a booster shot of their COVID vaccine. He believes people will need a third dose within a year of getting fully vaccinated. And we all may need annual shots going forward. I want to turn now to Dr. Uche Blackstock. She is the founder and CEO of Advancing Health Equity. She's also now an MSNBC medical contributor. Good morning to you. And let's start with the head of Pfizer saying that he believes people will need a COVID vaccine each year like we all get a flu shot. Do we know at this point how long immunity lasts with these COVID vaccines?
So the most recent study showed that we actually have immunity up until 6 months. And mind you, that is immunity from antibodies, but there are all different types of immunity that our immune system provide: B cells, T cells, memory B cells. And so that hasn't really been studied yet. So we can hope that we have immunity up until 6 months. Most likely we have it longer, especially when we compare this coronavirus to other types of coronaviruses.
And what about these breakthrough infections? Are you concerned that we're seeing somewhat 5,800 positive COVID cases among the 77 million Americans who are fully vaccinated? That number seems statistically insignificant. But still, if you've been vaccinated and you're still able to contract COVID, that seems like it could be a concern.
Right. And if you can remember from the clinical trials, the trials are done under controlled circumstances in tens of thousands of people. But when you increase the numbers of people who have received the vaccine, you are going to see breakthrough infections. The vaccines are not 100% perfect, but they are highly effective. And as you mentioned, that denominator is really big, 77 million. So it's only a fraction of a percentage of people who are having these breakthrough infections. And what we're seeing, which is reassuring, is that no one is getting hospitalized or dying from these breakthrough infections. So we're seeing that these vaccines are actually quite effective.
Let's talk about, for a second, what's happening internationally, because in Brazil, COVID, as I understand it, has killed an alarmingly high number of infants and children. A large part of the reason why COVID is such a big problem there is because the president there, he's a right-wing president, he's opposed lockdowns, he's only recently embraced vaccines. What's happening in Brazil with the variant there, and what threat can it pose to those of us here in the U.S.?
Yeah, no, it's actually really a tragedy what's happening in Brazil. It's almost like genocide. You know, we have a president there who is undermining the public health message, who is not taking the pandemic seriously. And as a result, there's no testing infrastructure, no contact tracing infrastructure. Their hospitals and ICUs right now are overwhelmed. And because there is unchecked transmission, we're seeing children, so many children being infected with coronavirus and developing the multi-system inflammatory syndrome as a result. This P1 variant is definitely very scary. We know that it's more transmissible, so it's more infectious. And there have been reports of people being reinfected with this P1 variant. And so, you know, definitely what's going on in Brazil should be of global concern to every nation.
Yeah. And for folks who aren't familiar with your background, a lot of your work focuses on medical equity issues. And I want to ask you about the J&J vaccine, because we're now on day 4 of this vaccine pause as it relates to this Johnson & Johnson vaccine. We don't know when it's going to be lifted. The thing that was great about that vaccine is it's one dose, it requires no special refrigeration, and so it's been counted on for hard-to-reach areas, for rural areas, for marginalized communities. How concerned are you that this pause will keep vulnerable Americans from getting the vaccine?
So, you know, I do have to say I am concerned. While I do think that the vaccine safety system is working well, and that's why we have the pause, I do worry about the length of the pause, especially if right now we're seeing this extremely rare event. I think that this vaccine for communities, as you mentioned, rural communities, underserved communities, people who are unhoused and undomiciled, who don't have homes to go to, the Johnson & Johnson vaccine really was the ideal vaccine. And we don't have sort of a one-size-fits-all vaccine, and we shouldn't, because communities have different needs. So I'm hoping that the pause will be lifted, next week. I think it's very important that Americans in various communities have an opportunity to access the Johnson & Johnson vaccine.
Dr. Uche Blackstock, appreciate you as always. Right now, COVID vaccine strike teams all across the country are on a mission.